tattooist as a legitimate health professional, as opposed to being an ancillary service provider. Our methods are providing comprehensive education created by health professionals for health professionals. Please join us. After 5 years of research and the review of over 200 scientific and clinical publications, we have now released our comprehensive course in SHIFT. With 60 hours of theory delivered via our CTA online multimedia platform and 40 hours of hands-on practical training. The course was developed in conjunction with a registered health practitioner and is intended for experienced cosmetic tattooers, paramedical tattooers, medical tattooers and health professionals. We confidently say that this is the most comprehensive course available in SHIFT internationally. Unlike some providers, all our courses are tailored to the educational background and experience of course participants, in full compliance with international training institutional requirements for recognition of prior learning. We do not take shortcuts with one-size-fits-all low-content courses. This procedure has been given many names in recent years. In our view, none of those terms are accurate enough for it to be clear to clients precisely what the service actually is, and some terms in use are downright misleading. I have adopted the trademark term scalp hair follicle simulation tattooing. The acronym is SHFST. We pronounce it SHIFT for simplicity, because I believe this is the most accurate description of the service being provided. Put simply, I'm simulating the appearance of a hair follicle on the scalp by tattooing pigment into the skin. This is our aim with scalp hair follicle simulation tattooing. It is important to note that there are several forms of alopecia that may be aggravated or exacerbated by scalp tattooing. For this reason, our course covers the various types of alopecia and those conditions that should not receive scalp tattooing. Overwhelmingly, the request for this procedure comes from clients with androgenic alopecia, which is more commonly known as male pattern baldness. An ethical provider will establish the cause of the alopecia prior to providing the service. Androgenic alopecia affects men in all age brackets and ethnic backgrounds, with some slight variations in incidence and prevalence. Androgenic alopecia affects all classes and social brackets. The prevalence of androgenic alopecia steadily increases with advancing age. By the age of 70, between 50 to 60% of Caucasian men will have some degree of male pattern hair loss. Apparently, even cartoon characters are not immune from androgenic alopecia. Camouflaged hair transplant donor scars, in particular after follicular unit strip surgery, or FUS. Our course covers the and includes our own proprietary donor scar grading system. There are several methods of grading androgenic alopecia. We have seen many instances where practitioners have embarrassed themselves by confusing the various types of grading methods. Our course covers the commonest grading systems used by the medical profession for both male and female androgenic alopecia, and our own proprietary grading for patch loss alopecia areata, transplant donor and recipient scar grading. It's all consolidated into a single, easy-to-use reference. You can use the grading scales to help you communicate on the same level with transplant surgeons and other SHIFT practitioners, and to maintain professional client records for future reference. Transplant donor scars will come in a variety of shapes and sizes, depending on the type of and quality of transplant the client has had. Many clients who have had prior FUS surgery suffer significant regret and embarrassment caused by the noticeable scars. FUS donors may also contain dense, irregular or knotty fibrous tissue that has a low tolerance for pigment implantation. Our course covers our methods for softening and normalising scar tissue prior to pigment implantation, including the role that Mesovitel can play. We also include a customised Mesovitel technician's manual for FUS donor scar treatments. Paramedical and medical tattooists have been providing scalp camouflaging tattoo services for clients for at least the last 20 years. And this has included attempts to obscure small patches of hair loss and transplant scars with pointillisms and etching strokes in an effort to mimic the appearance of hair. Poor quality results from service providers in Australia, the USA and the UK. And what's wrong? Well, it's the wrong choice of pigment type and colour. It's the wrong size pointillism, the wrong distribution, and there's pigment migration. This is the same client once it was healed. This attempt at scalp tattooing draws more attention to the area because rather than camouflaging the scars, it looks like they're inflamed. This client requested correction of scalp tattooing, which was performed by a cosmetic tattooist who had no training in providing shift services and was experimenting with providing the service. Some service providers who are considered to be achieving poor quality outcomes are actually training others to replicate their poor results. In this instance, the client was devastated and could not leave home without wearing a hat. And what's wrong? Well, the pointillisms are far too big. There was no measuring of the hair follicle sizes and matching to needle size. A sure sign the technician did not know what they were doing. They're not evenly or naturally distributed. They're the wrong colour. There's pigment migration and pigment coalescence. This is the same client. Pigment migration and coalescence are significant problems with scalp tattooing. Our course covers detailed information on how to minimise the risk of these two tattooing. Equally, it is also imperative that the clients follow the advice provided. In spite of warnings, the client pictured applied an experimental hair loss treatment, RU58841, to his scalp, which over a period of months caused pigment colour change and migration. Our course covers the oral medications, scalp lotions and therapies that pose the greatest risk to causing an adverse outcome, and includes detailed pre- and post-treatment advice sheets for the clients. This is not available in any other course. This scalp tattooing was performed by a cosmetic tattoo trainer and medical tattooist who has not had training in providing shift. After providing poor quality scalp tattooing, the technician tried to remove the tattoo pigment with the wrong laser frequency, causing the pigment to turn blue and migrate, and resulting in a loss of natural skin pigmentation. None of these clients who requested corrective work had a test patch prior to providing the full treatment. This is another sign the technicians did not know what they were doing. And I doubt any of these clients would have proceeded if they had seen a test patch result. Good quality training should always be the first step when providing any client services. Can they start the video? Yep.
메이크업도 한 것 같아. 삐 있어? 응? 삐 있어? 어디서? 그치? 수직심을 될 것 같은데. 그렇지, 수지치. 좋은 아이디어잖아. 그죠? 근데 웬만하면 머리를 살려야 돼. 나게끔. 그렇다면 물이 다 죽어버리고.
We can look at the video, and at the same time, I'm sure that you have questions about this procedure. And yeah, Sonia has the first one.
Actually, as by watching a little longer, I was just asking if you were working with a sensor drive already.
No, they let me have one yet.
No, okay.
But as soon as they let me have a sensor drive, I'll be working with a sensor drive, but I was working with the precise handpiece for some of it. If you can see, some of it I'm actually using the precise handpiece, and some I'm using the standard handpiece that came with the Supreme.
Thank you. More questions? Okay.
What number? 3. Okay.
Entonces tú dije que no hay diferencia entre los pigmentos para la estética y para el cuero cabelludo, pero yo tengo un poquito solo de experiencia con este trabajo. Mirando, esta es la tercera aplicación, ¿correcto? ¿Es la tercera?
The one on the brochure, that's his second treatment. Okay, so this one, he's had 2.
Sí, es la segunda.
This one's had 2. Most clients who have scalp tattooing will require at least 3 initial procedures.
Es que es muy difícil de mantener el punto que... Sabemos que es muy difícil de mantener el punto en su dimensión inicial de la aguja. La impresión que yo tengo que también, disculpa por favor, mas la impresión que yo tengo que también aquí era expandir.
You always get a very, very small amount of pigment spread with the dots, with the pointillist dots.
What you're doing is very beautiful, I said.
Thank you.
Very nice work. But I have a couple of questions, please.
Yeah.
The first one, when you finish, when you return, the patient return and you make another treatment, how long it stays on the scalp?
How long between treatments?
No, when you finish.
Yeah.
How
very,
long it stays, the color
okay,
stay on the
that's very